There is a disease that, at this very moment, is robbing millions of people around the world of their sight. And most of them don't even know it. It doesn't hurt. It doesn't give you a warning. It doesn't appear suddenly. It simply creeps up on you, silently. Its name is glaucoma. And understanding how it works can be the difference between preserving your vision for decades or losing it irreversibly. What is glaucoma, really? Glaucoma is not a single disease. It is a group of conditions that damage the optic nerve, the cable responsible for sending images from your eyes to the brain. When this nerve is progressively compromised, vision gradually disappears, and what is lost is gone forever. Glaucoma is the second leading cause of blindness worldwide, second only to cataracts. And unlike cataracts, this blindness is irreversible. PubMed Central. Currently, more than 80 million people worldwide live with glaucoma, and that number is expected to exceed 111 million by 2040. Bright Focus Foundation. In the United States, approximately 4.22 million adults have glaucoma, and half of these people do not know they have the disease because in the early stages, it simply has no symptoms. Institute for Health Metrics and Evaluation. Why is it called the silent thief of sight? Open-angle glaucoma, which is the most common type, gives no warning signs until vision is already visibly impaired. This painless condition usually begins with the loss of peripheral vision, the sides of the visual field, making it difficult for the patient to notice the changes until the disease has already progressed significantly. Glaucoma Research Foundation. Think of it this way. Your central vision remains normal for a long time. You continue to read, watch TV, and recognize faces. Meanwhile, the edges of your visual field are quietly disappearing. It's as if someone were slowly closing the curtains on a window, and you only notice when it's almost completely dark. Who is at risk? Here's what science clearly tells us. Age is the main factor. The incidence of glaucoma increases significantly with age, from approximately 5.5 cases per 10,000 people per year among those aged 40 to 44, to more than 64 cases per 10,000 people per year among those aged 75 to 79. Jog family history increases the risk considerably. Having a first-degree relative with glaucoma can increase the risk by up to 2.85 times. Jog elevated pressure inside the eye. Intraocular pressure is the most important modifiable factor. The most common type of glaucoma can be caused by the buildup of pressure inside the eye, which over time damages the optic nerve. Bright Focus Foundation. Other health conditions also play a role. Diabetes, hypothyroidism, and the use of corticosteroid medications can also contribute to the development of glaucoma. High myopia is another documented risk factor. People with high myopia are about twice as likely to develop glaucoma compared to the general population. There are two main types, and this matters. Open-angle glaucoma is the most common, accounting for the vast majority of cases. It develops slowly and painlessly, which is why it is so dangerous. Acute angle closure glaucoma, on the other hand, is a medical emergency. In this type, the flow of fluid inside the eye is suddenly blocked, causing severe pain, nausea, vomiting, blurred vision, and colored halos around lights. If not treated immediately, it can cause blindness within a matter of days. Bright Focus Foundation. If you or someone close to you suddenly experiences these symptoms, seek urgent medical care. How is glaucoma diagnosed? The diagnosis is made by an ophthalmologist through specific tests. Tonometry measures intraocular pressure. The visual field test detects loss of peripheral vision. Optical coherence tomography, OCT, analyzes the thickness of the optic nerve with high precision. And a direct examination of the fundus allows visualization of the optic nerve. The critical point. These tests need to be performed routinely because glaucoma will not give any warning signs until the damage is already occurring. Is there a treatment? Yes. And here is some essential information that many people don't know. Currently, there is no cure for glaucoma, and vision loss caused by the disease is irreversible. However, medications and surgical procedures can help slow down or halt the progression of the disease. With early diagnosis, blindness is now considered a rare outcome. Glaucoma Research Foundation treatments include eye drops. These are the first line of treatment. They reduce intraocular pressure and must be used strictly and consistently. Laser, trabeculoplasty. a minimally invasive procedure that improves the drainage of fluid within the eye, reducing pressure. Surgery. In more advanced cases, it may be necessary to create new drainage pathways inside the eye. Mid-video, call to action. Now that you understand what's at stake, I need to tell you something important. In addition to medical care, nutrition can be a powerful ally for your eye health. That's why I've included a supplement in the first link in the description that I've specially selected to support eye health, with ingredients studied to protect the optic nerve and combat oxidative stress in the eyes. Click there, take a look, and decide if it makes sense for you. The link is right below. What about nutrition? Does it really help? This is an area with a lot of ongoing research, and it's important to be honest about what the science says. There is evidence that diets rich in leafy green vegetables, which contain high levels of nitrates and nitric oxide, are associated with a lower risk of glaucoma. Glaucoma australis, lutein and zeaxanthin, found in spinach, kale, and other dark green vegetables, have antioxidant properties relevant to eye health. Nutrients, antioxidants, and organic compounds have attracted growing interest over the past decade as complementary strategies to slow the degeneration of optic nerve cells. MDPI. But it is essential to be clear. Supplements and lifestyle changes cannot replace eye drops, laser treatment, or surgery when these treatments are prescribed by a doctor. Glaucoma australis. They are a complement, not a substitute. What you can do today? Get regular checkups, especially if you're over 40, have a family history of glaucoma, diabetes, or high myopia. Manage your blood pressure. Blood flow to the optic nerve is directly affected by cardiovascular health. Engage in moderate physical activity. Regular aerobic exercise is associated with a modest reduction in intraocular pressure. Eat a varied and colorful diet. Dark green vegetables, colorful fruits, and omega-3 rich fish such as salmon and sardines. Don't smoke. Smoking impairs ocular circulation and increases oxidative stress in the eye's tissues. If you already use eye drops, use them consistently. Since glaucoma is a chronic condition, lifelong monitoring is essential and highly effective. Glaucoma Research Foundation. The most important takeaway: you don't lose your vision all at once. You lose it silently, in small increments that could have been detected. The science is clear. Glaucoma has no cure, but it can be treated. And the earlier it's identified, the better your chances of preserving your vision for decades. The question isn't, do I have glaucoma? The question is, when was my last comprehensive eye exam? If the answer is, a long time ago, maybe it's time to change that. Take care of your eyes. They're the only ones you have. If this video helped you, subscribe to the channel, because here we talk about health with real information, no nonsense. This video is for educational purposes only. It does not replace a consultation with an ophthalmologist. If you experience any vision symptoms, see a doctor. Translated with deepl.com, free version. Translated with deepl.com, free version.